The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And welcome to it here, 5 minutes after 11 o'clock on your Saturday morning. PinPoint Health Show is on and ready to go. You've probably got questions this week, if not more than any other, about the current situation that's affecting everybody. 416-870-6400 is the way to go. You'll want to reach out to Dr. Lou on air. You can do it right now. And there you go. It's going to be a busy show, man. What do you want to start with?
Hey, John. How's it going?
Good, pal. I'm just like you, doing the social distancing thing, staying at home, as are you, right?
So I'm at home. I got my own little makeshift studio set up, but
nice.
As long as you guys can hear me, I think we're good to go. And I think, like you started saying there, is today's as good a time as ever for you guys to call in. The phone lines are open. I'm happy to take questions around the whole COVID-19 situation, specifically the things related to health. And so, I've been called upon a few times for some interviews around various topics over the last few weeks, and it's my pleasure to help out. I think, I heard somebody say to me that the cure to COVID-19 is going to be knowledge, and that knowledge will give us all power to do the right things. And, this idea that we're waiting for some miracle or something like that, those things are already being put in place. And if we, as a population, all do our part to follow the things that have been suggested, then, I think we're going to get out of this sooner rather than later. And I mean, I want to be realistic about that. Sooner doesn't mean next week, but we're talking about when you look at pandemics like this, these viruses could last anywhere up to 2 years, right? Maybe even longer. We don't know what happens. And so, we have the choice to make right now on, are we looking at 2 years of our lives being like this, a year of our lives being like this, 6 months of it, 3 months of it, maybe 3 months on, 3 months off, like who knows what it's going to be. But I think right now is the crunch time for doing those right things. And I think that the harder we can hit it right now that we're in the early stages, I mean, whatever's happened has happened, so we can't really go back. I have some issues with the things that have happened thus far. I think there's been a number of mistakes that have been made, but again, those are things that we will reflect on as a society one day, and in order to be better prepared for potentially another one, or we can maybe do better to prevent these things. But I do think we dropped the ball in some areas, and when I say we, I mean governments. But where we are right now, I think most governments around the world are doing the right things. I think maybe some governments should be doing even more, and taking it to another level, just because I think, again, the harder we can be at it right now, the greater of an effect we'll have. I remember when we had, this must have been back in February, when Minister Elliott was on the show, and we spoke about the R-naught, which is the amount of people that this can infect. And the numbers are ranging somewhere between, if you have the virus, you might be affecting between 2, 3, some papers are even showing 4. This is why social distancing is so important, right? Because if you're around people and you have this virus, and I think one of the things that people really need to appreciate is how not easy, but this virus is a monster in the sense that we've had viruses that maybe are potentially more lethal, but they don't have the virulence of this one where it spreads. And we've had other ones that spread even quicker, but aren't necessarily very bad. So this is the perfect combination of a perfect storm, a perfect disaster. And that perfect disaster means that if we're getting 2 to 4, if every person that has this, and again, being spread potentially when they're asymptomatic is what the new research is showing, then really what we're creating is 2 to 4 people. If you socially distance and you are not around 2 or 4 people, you are going to infect 0, right? And the idea is the lower we can bring that reproductive number that are not, the more likely we are to stop this. That's why social distancing works. And again, I will reiterate that the idea of waiting for some magic treatment right now. I think our best chance is going to be an eventual vaccine. I think there will be treatments that happen. Are they going to be the be-all, end-all? I'm not sure. But what I can tell you is we shouldn't sit by waiting when we know we can be doing things right now, which is the social distancing. That is by far the most important thing that everyone should be doing. And the more you can do that, the more you can practice that, the more we stop that reproductive number. The more that reproductive number stop, the quicker we get out of this.
Again, 416-870-6400. We'll take one little break here. We got so much to talk about in this regard. If you have questions, bring them on. This is a show you want to do it. Well, Dr. Lou, you have his attention, so do that as we continue here, the Pinpoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
It is 11:14 on your Saturday morning, and back to the Pinpoint Health Show. If you want to reach Dr. Lou and his team by phone, that is still happening, 1-855-55-Dr. Lou, info@pinpointhealth.ca. And again, reminder, there's always amazing stuff, videos about general health, and of course this COVID-19 on their social media, including Facebook and their Instagram. So, pal, yeah, it's as mentioned, it's going to be a busy show. 416-870-6400. Let's bounce right over to the phone call. Darren, thank you for hanging on. Good morning.
Good morning, and good morning, Doctor. How are you?
Good morning. Nice. I'm doing well. How are you?
I'm doing just fine, thanks. I'm in my own little physical distancing bubble here, so we're doing
Beautiful.
Just fine.
You know, it's one thing before you ask your question. Number one, I want to thank all of the frontline healthcare workers that are in the hospitals doing their part. I have friends, family that do that role. I've been messaging them and really making sure. But what you just said, what I want everybody to realize is those frontline healthcare workers that are heroes. What you just said there is very important. We could all be the hero we all need each other to be by just being away from others. So thank you for doing that. And go ahead, ask me your question.
Yeah, it's my pleasure. And again, kudos to everybody on the front line of this war. And I'm calling it a war because let's be frank and call it what it is. So
it's a war. It's a war. You're right.
Absolutely. So just a question, because we're always hearing about these breakthroughs from like Germany and Brazil and even out in that Western University here in Ontario about these breakthroughs in terms of the virus, determining the actual DNA and RNA sequencing of the virus, doing all different sorts of things in the hopes of developing a vaccine. And everything that we see is we're one step closer. So I just wanted to get your take and just your opinion on how far out do you think a vaccine is? And, you know, depending on that, how quickly do you think it would be deployed? And I'll just take my answer off there so I don't take up your time. Have a great day.
Okay.
Thanks so much.
Thank you.
Thanks, Darren. Stay safe.
And that's a great question. So the question being about how likely a vaccine is to come out soon. So one thing that I will say is this. The part about actually making a vaccine, what a vaccine is essentially when you could take the virus or whatever it is, in this case being a virus, and you can somehow have a virus that's either been attenuated so that it doesn't work or and it won't multiply. You can inject it into somebody's body. That's all a vaccine is, right? You're taking whatever the virus, whatever the thing is, you're taking it in an amount that's deactivated. You're putting it essentially in the person's body, and you're allowing that person to make its own immune response. That way, if they ever come in contact with that pathogen, you already have those antibodies that would be needed to fight it. So that's what a virus is, simply. The reality is they've already been able to make certain viruses that they can show. The problem is the steps that are required to get it ready for public use. So they've already been able to show in animal models that if they take something, they can get the virus, they can introduce an attenuated version of it into an animal. The animal can then create its own immune response. At a later date, they introduce the virus, and the person and the animal, not the person, doesn't get sick. So that step has already been done. The problem that we have is the regulations that are required. And this is one of the arguments, again, towards the anti-vaxxers, which sometimes I hit hard, but I hit them hard because I think they need to. If this was some type of conspiracy, we would have just already released it to everybody and not known the side effects. You need to do now human trials, and I believe they've already done a few, actually, where you need to make sure that that vaccine doesn't have any negative consequences to the person it's being given to. That's an important aspect. Although you can give someone the vaccine right now, we wouldn't know what type of consequence it might have in the long term. So really, most of the experts are saying that we're probably, it's not going to be ready by this within this year in the 2020. It might be available for the fall of 2021, depending, because again, these human trials take an extensive period of time. So it's an important thing. The other thing that I would encourage people, I really, for my knowledge on this stuff, I like to use the Center for Infectious Disease Research and Policy, or short form CIDRAP, CIDRAP. It's a great resource. It's all scientifically based, and a lot of their work is towards creating a vaccine. So I guess the short answer is that it's not that hard per se to create it, but it's the problem of the human models. And as an example, the Ebola outbreak that happened in 2014, I believe it was, just after that time, they were able to make some vaccines for it, and by the time it was deployed was 2019, just around when this virus sort of emerged. There was another small outbreak happening in Africa, and so there you go, like a 5-year span. So these things don't happen quickly, which is why I'm saying we can't be relying on the fact of it doesn't matter. It's not about we've already done the sequencing. They've already figured those things out. It's the human trials now that are very key to make sure there's no negative consequences. Those cannot be expedited. There's no way to expedite that. So we're working within. They are working within that time frame. So that's what I mean. We've got probably 18 months to 2 years before we'll have a vaccine, and so that's why these things of the social distancing and the other measures we're doing right now are so important.
We'll take a quick break. You have questions about COVID-19, if it affects you directly or if it has, or your family, or you're just stressed out about it. Bring it on. Dr. Lou is here to answer all those questions. 416-870-6400. Now is the time you want to ask them. It's 11:21. We'll continue with more of the Pinpoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Yeah, it's an important call. You want to make it, get some answers. I know there's a ton of questions out there. It's 11:23 Pinpoint Health Show. Dr. Lou here to answer them. Richard, thanks for calling in, pal. How are you this morning?
Yeah, I'm great. Thanks, guys. Thanks for being there. This is all excellent information. I'd just like to ask, I think we've all heard that the origin for this virus came out of what they call those wet markets in China. Yeah. And which they sound horrendous. I was just reading more about them this week, and I think the British media especially is being very hard on China, saying, what are you doing about this? But what I found really very perplexing is that I understand that China seems to have this a little bit in their rearview mirror, and it's almost becoming business as usual. But the main thing is, I heard that these same kind of markets are up and running again, which just blows me away. So I'm just wondering, is it incumbent upon the other countries in the world, the G7, the G20, to really try as much as they can? I mean, China's not going to apologize for anything, but is it incumbent upon the other industrialized countries to say to China, listen, we've got to hold you account on this, because if they're going back to business as usual, is it not just a matter of time before the next wave hits us and the next one and the next one? This is outrageous.
Yeah, I mean, it's a great point, and it's a great question. I mean, obviously what I'm doing is more the healthcare side of things, but I obviously have a political view as well, and I'm happy to sort of give my opinion. I I've heard those things about the wet markets being open again. I don't know for sure, right? Because that's not really where I put a lot of my focus in terms of my research to substantiate it. So I don't want to say for sure. What I do want to say is I think it is important. You hear a lot of politicians. This is my political view, and this is my personal political view. You hear a lot of politicians around the world talking about this is nobody's fault. This just sort of happened. I strongly disagree. I think there is clearly a country to blame for this. I think that whatever, it is what it is at this point. But at the very least, we need to learn going forward. There have been a number of different coronaviruses that have emerged. I think what humanity needs to realize is these things emerge when there is abuse between humans and animals in some type of being co-located, doing these types of things. It's a very, very dangerous thing. And it just took, again, I've heard things like people saying, oh, this is chemical warfare. No, it's not. There are hundreds, if not thousands of coronaviruses that exist in animals. It's just a matter of statistics. Over enough time, over enough jumping to people, you're going to find the right one like this one that has it's got like this perfect key and lock combination for our ACE2 inhibitors, or our ACE2, I can't remember the name right now, but anyways, that's where it locks onto. And so I think that's a very important thing, that people realize that it's just a matter of time before this stuff keeps happening. So I think when we're through this, maybe it doesn't help to do it right now. There needs to be accountability. The other thing that I'll be talking over the next few weeks that's really important is how much from a healthcare perspective we've become so reliant on China. And that's a problem too, because so much of our other medications that we need are made there. And if there's problems, and this is why I think there's a lot of fear in the world to say these types of things, because of how much so many countries have become reliant on that Communist Party. And this has nothing to do with the Chinese people, may I add. No, this has to do with the country, the way they run that country, and there are inherent problems there. And I agree. From my political standpoint, I do think that these things should be looked at. I think there needs to be accountability in place accountability. And more than accountability is how do we prevent this from happening? And if I know that they have not been able to absolutely identify exactly where this came out of, but all arrows are pointing in the same direction, right? So if it looks like a duck, quacks like a duck, it's probably a duck, is what I'll say.
Yeah, and if I may say, I mean, when reading about these wet markets, like the lack of proper hygiene is just outrageous. And one more point, if I may, there was one of the news conferences this week with Trudeau and the health minister. Somebody brought this up, and the health minister, I couldn't believe it, was really firing back, saying, "Hey, that's just talking about conspiracy theories." Where I thought, are you kidding me? I mean, but that's again, as you're saying, Doctor. I mean, there's so many people out there of influence who are just bowing down. They dare not say a word of negativity against China and the origin of this, which is just despicable.
To interrupt you there, Richard, and I'm sorry. I'll encourage everybody, go watch. One of the doctors from the World Health Organization has asked a question about Taiwan, and look at that response. And I won't say any more, but go look at it, which sort of shows you the political entanglement that's happening around the world, and why this person from the World Health Organization would even divert this question this way is there's deeper levels of political things going on that, again, that's outside of sort of my scope and my show, but I appreciate the point, and it's well received.
Richard, appreciate that call. We'll talk more about that. Frank, we'll get to you in a moment here. Want to take a quick break, guys, and get right back at it. You have phone calls, even more on the medical side, of course, with COVID-19 and the coronavirus outbreak. It's affecting all of us, and I do mean all of us. Bring your questions on. Dr. Lou's here to try to navigate through as many as we can. 416-870-6400 right there. Pinpoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
11:32 Pinpoint Health Show. Info at pinpointhealth.ca. You want to reach out to our 1-855-55 Lou for the remainder of the show. Of course, we're taking all of your health questions as we do every week and have been for years on the show. But of course, hyper-focused on COVID-19, the coronavirus. You have questions, concerns, stresses about it, bring them on. We'd love to talk to you. Frank, thank you for hanging on. You are up next. Fella, how are you this morning?
Good. How are you guys? Being safe?
Yeah, pal, we're separated. Yep. What's going on?
How do you deal with the stress?
The only positive thing of this COVID crisis is I don't have to see John Scholes, may I add.
You know, it right back at you, buddy. Anyway, go ahead, Frank.
To interrupt. What's the question?
You know, I'm happy that everyone in my family's doing okay. Those around me are okay. But as a landlord, I'm stressed, and it's eating me up alive inside this COVID-19. I feel bad for tenants. I feel bad. Like, I worked my whole life. I have an 8-unit apartment building, and tenants are taking advantage of this. And it's stressing me out because I know that they're working because they're all in essential fields and they're refusing to pay rent because of what the media is told and what they understand from the media is. I still have to go pay for the repairs. I'm still paying for the maintenance of the property. No one's deferring that. My taxes aren't being wiped out like they wanted, but they're just being deferred. Tenants are refusing to pay me, and it's just eating me up alive. I don't sleep.
Yeah.
You know, I don't eat. It's just it's the government who just didn't come clear with it. Now, where the tenants loved me in the past, now I'm looking like the devil to these guys. Mm-hmm. I got to eat too, and I'm not one of these. I understand there's some of these big landlords who hear stories about buy groceries. I have 8 units. I live off those 8 units, and I'm being eaten up alive at the back, and it's just full of stress. And people are taking advantage of.
Frank, if I can interrupt, because I hear you loud and clear, and I hear you from a number of different perspectives. I'm a business owner, as you know. In some areas, I am a renter. In other areas, I am a landlord. So I hear I'm sort of in this on both sides. I hear you completely. Without getting into the question about the political side of things, which I hope there are politicians listening, because I think the points you bring up are great. But one of the things that I'll be focusing on in the next few weeks, and I'll have some experts coming in, and another thing that I want the listeners to know, this week I'm going to be working on getting a YouTube channel up. I have a lot of great resources of people that I have, and I'm going to be doing podcasting where I'm actually having interviews that you'll be able to go, and you know, we're limited here on radio. We've got a lot of things, so there's a lot that we can talk about, and I'm going to be doing that specifically for this COVID crisis, all different types of things, and I encourage people. I will keep you guys posted. Follow me on social media, Dr. Lou on either Facebook or Instagram or LinkedIn, whatever. Dr. Lou Nally, Nalli. But I think it's important that we talk more about that. But one of the things that your stress is from a health perspective, my concern right now. What we have not considered in this pandemic is the long-term health consequences that people are going to suffer outside of just those individuals that potentially get the virus, the amount of stress, anxiety, and depression that will be a result of things like you're talking about, Frank. There are people who are losing loved ones that can't even have funerals for them or be next to them as they go on to whatever's next. And it's just from a mental health perspective, it's going to be an absolute atrocity. The other thing that I'll say, and I see we've got some callers, so I'll make this short. And again, this will be focused on more heavily in the coming shows and on the YouTube podcast that we're going to start, which will be the Pinpoint Health podcast, is we've asked a population to quarantine, to be isolated, to not do anything, which is probably the right thing in my opinion, and the research to do. However, the public health concern that I have that I don't think enough people are speaking about is when you look at this virus, okay, there seems to be a number of things that make it more fatal for the average person, okay? And those things are other comorbidities. Specifically, the research is showing hypertension and insulin resistance or diabetes. Mm-hmm. In fact, with CIDRAP, what I was mentioning, they've just seen new data come out of New York that shows people in their 30s, 40s, and 50s are passing away. And the one thing that they have in common, and why this is going to be more of a problem in North America, obesity. Okay? So we have asked people to self-isolate, stay at home, do nothing. They've raided grocery stores. They've bought heavily processed foods. They're probably overeating, under-exercising, and probably doing all three of those things. Research will show that even in 2 to 3 weeks of creating new unhealthy patterns, you can start to have a negative effect on blood pressure. You can start to create some level of insulin resistance, and you could start to pack on the pounds. And nobody's talking about this, and that to me is a shame. And that's really where I want to focus my experts, being an expert in that area, is making people realize more than ever right now, yes, you have to be home. Yes, you have to isolate, but you need to be taking care of yourselves more than you ever have. Okay, this is incredibly important because when we look at the risk factors for what causes this to be fatal, all of those risk factors are negative lifestyle consequences like hypertension, like insulin resistance, like obesity, that are things that can be modified with lifestyle. And we are telling people, stay home. Don't worry about your lifestyle. Nobody on the media is talking about that. I see no public health officials addressing that, and it needs to be addressed.
Yeah, sit around and listen to watch Netflix for 5 weeks is not the right prescription.
Eating chips, drinking Coke, like that, it's a recipe for disaster.
Mm-hmm. Yeah, they're already calling it the COVID-15. I mean, sort of tongue in cheek, but they're saying when this is all over, you come out 15 pounds heavier, and it's not a joke. It is real, and that's why, to your point, Dr. Lou, that I've seen more and more. Thank God on YouTube, people we've had on Greg's show with some guests, that there's a lot of people who run gyms and they're flooding YouTube with these. Here's how you want to train it. We're at home. You want to pick up a jug of vinegar, use it for a dumbbell, whatever you got to do. Get out there and move your ass. Move your ass.
And you're right. The problem is that the people that will go to that are already the health conscious minded. It's really about that. The public health officials, when they're sitting down at Queen's Park or in Ottawa or in Toronto, and they're sitting there telling people how important social isolation is, these public health officials need to be telling them also, when you're isolating more than ever, it's important to live healthy, to try to, you can do stuff in your house. You don't have to go anywhere to increase your cardiovascular fitness or watch what you're eating. So that you don't have these negative consequences happening if you do unfortunately catch COVID. But, I see we've got other callers, and I think maybe we need to take a break. Do we, John? You're going to...
yeah, we'll you know what? We'll take a quick one so we can have more time with each of them. So, Corey and John, hang on. We'll get to your calls, and you as well, 416-870-6400. Important stuff. You have questions, bring them on. This is the time to do it. PinPoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
$11:42, Pinpoint Health Show, reaching out, info@pinpointhealth.ca, 1-855-55 Dr. Lou, DRLOU, and go to social media and search Pinpoint Health for
John,
for so much more. Yeah, man.
Sorry, it's tougher when we're not in the same room. I don't want to speak over you, but one thing that I want to, before we take, I see the calls are coming in, and I love it, and I want to take them all. One thing that I want to be clear about with what we do at PinPoint Health, a lot of people are still suffering with pain and injury. The world is essentially on a shutdown. I want people to know PinPoint Health is open. We're open. The vast majority of things can be dealt with through virtual care. My assessments are being done virtually right now. In the event that someone does need to be seen, because it is absolutely urgent, and we have specific criteria for that because we are an essential service for urgent cases, we have gone through an extensive procedure that people can see on pinpointhealth.ca. If you go to the site and you just click the top tab, it says COVID-19 Pinpoint Health and safety procedures. You will see an incredibly extensive list that I've worked on with my team, that in the event that someone does need to come in for an emergency or an acute case, that you can feel safe, that you can be taken care of in the right way, and more so that the staff is also safe and I make sure to take care of them too. So I want people to be aware of that. But what I think people should not be afraid of is just call the number, because the vast majority, 99.5% of things, at the very least, I can provide you with advice over the phone on how to manage your things. So do not be afraid. That number is still available. Call me at 1-855-55 Lou, DRLOU. I will get back to you if you want to set up a virtual assessment. We will do so. A lot of this stuff can be done that way. You don't need to suffer at home. Just a quick interjection there.
Beautiful. Wonderful stuff there. Corey, you're up. Thanks for hanging on. Good morning.
Good morning. How are you doing today?
Good. What's on your mind, pal?
I've been talking to a lot of people about this quarantine stuff, and I've been on the other side of the argument from majority of the people I've been talking to, because of the fact that I kind of think outside the box on this thing. I don't believe that people are, like, humanity in general is the human condition is that we don't obey all the rules in general. There's always going to be crime. There's always going to be people that are doing drugs, and you're never going to be able to stop any of these little things completely, any of these problems that humanity does. And right now, I believe that social distancing right now is only at 50%, and we need 90 in order to completely stop our problem. So I've been telling people, hey, look at John Tory right now. Look at the politicians. They're power grabbing, and they're creating these new fines, new regulations. And what does that do? It just it's not going to help the problem, just like it won't help the war. It didn't help the war on drugs.
Well, okay, so I'm going to interject there. I'm going to interject. I agree with you that probably more needs to be done. That the more social distancing we can impose, the better. Where I disagree is that this is not an all or none, right? This isn't like if you don't have 90% of social distancing, there's no effect. Right? It's a proportional type of response. So, we may not be perfect. The stat you referred to is 50%. I'm not aware of that. But even if that stat is correct, we are still having an effect, because it's not an all or none. It's a proportional response. It's a dose response. And I think that's very, very important. And, I agree with you. A lot of people are defiant, and most rules in general for anything are not made for those that need the rules. They're made for those that would need the rules. And a good example of that is like gun laws, right? The gun laws don't prevent criminals from using guns and doing the wrong things. They just simply probably prevent law-abiding citizens that want to own a gun. And this is not me wanting to talk about owning guns or not owning guns. But as an example, I agree with the point that laws often exist because those who aren't going to listen to them anyways, they have to be imposed. And the only people that they do really restrict are the people that are listening. My role here, what I am trying to do is I am trying to plead with all of those who listen on any of my channels, any influence that I might have. You can make the individual choice. As an example that I will give you, my mother has COPD. I have not seen her since the start of all this, 4 weeks ago. She's been babysitting my kid once every week since he's been born, and he's not been around her. Although it hurts me from a emotional perspective, it is the right choice, and that keeps her safe. So it's a proportional response. The more we can do, the better, and we have to keep doing more. Thank you for your call. Okay.
Corey, appreciate the call. We're going to move on here. 416-870-6400. John, thank you for hanging on. Good morning.
Okay, this is a little bit different. I'm having difficulty with delivery from my prescription from the pharmacy. They deliver from 2 to 8, and I've called 3 times for delivery, and it's never arrived. So I went and picked it up myself, and it seems to be a shortage of the medication that I need. It's a small infection on top of my hand. I've had it before, and what I used before was Betaderm. That was about 3 years ago, and that really works good. And what you've given me now is not doing me any good whatsoever. And you told me there was a shortage of Betaderm, betamethasone, or something. However,
okay.
That.
So what
only get
What's the question,
only
John?
get 5 tubes, and you have to wait 11 days. And
Right.
I don't want to go back and forth with all this COVID-19 going on. I'm a senior citizen, and so how can I get? Is there a shortage of Betaderm? Because that'll make this thing go away, and I won't have to worry about it.
So I've spoken to some of my friends that are in the pharmacy world. Again, when you look at the reliance that we have on China that exports, I forget the exact stat, but it's definitely over 80% of the world's medications. This is a big concern. This is one of those long-term health consequences that I was talking about, that if this goes on long enough. The other thing that's happened is similar to the grocery stores where toilet paper ran out. People have been, in the beginning, were hoarding medication. And again, it's disgusting that people do that. So, John, there's multi-factors that are going on there. I can't really control it. I can tell you that all of this is a result of the problems that are happening as a result of COVID. This isn't just the disease process itself. This is bigger.
John, appreciate the call. We're going to get to more here. I see you, Cam and Linda. You're coming up next, so stand by. We'll get to you. PinPoint Health Show, Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
Hey, welcome back, PinPoint Health Show. We got a few minutes left here, so I'll take your calls, ask your question, and then we've got to move on because we want to try to get to everybody. Cam, how are you? What's going on?
Good, and I just wanted to ask Dr. Lou his thoughts on interferon alpha 2B as a disruptor, not as a vaccine, as a disruptor. I just want to I'm going to point out my plan to you here. I need that question answered, then a military deployment, and then future embargoes on China as we go forward.
Okay, so I can answer the interferon alpha 2B question that you have, which for the listeners, that's an anti-viral, anti-neoplastic drug. So it's used a lot in leukemias and lymphomas and things like that. It's also being used, I believe, in things like hepatitis. To my understanding, I believe there are some clinical trials with that antiviral being used, but again, there has been no scientific consensus on any type of medication right now on something that works well for this, right? Similar to the anti-malaria drugs, these things are being tried in clinical trials to see if they have an effect, but to the best of my knowledge, there's no conclusion right now as to whether there is an effect or is not an effect.
John, appreciate the call. Got to move on, though. Get him in. Linda, you're up next. What's your question?
Hi, I was just wondering, with the first plane load of people that came back from various countries, they were isolated up in Trenton.
Mm-hmm.
Mm-hmm.
And the ones that are coming back on the weekend, the ones that are back now and the ones that are coming back on the weekend are not going to be mandatorily isolated. And I would like to know why.
I
don't know
no
if
idea.
you guys can help me with that or not.
Yeah, no, I'm not a politician, so I can't tell you why it's not being done. What I can tell you is, again, I started the show by saying that I think at some point we're going to look back and see where there were slip-ups. And one of the examples where I believe those slip-ups happened is it would have been early on in this January, late January, early February. There were a lot of people calling for a travel ban on China. And the World Health Organization at that time said there is no evidence to suggest that doing so would prevent the spread of this disease. Fast forward 2 months, 3 months, wherever we are now, and there's a travel ban on the whole world. No one's going anywhere. So,
right.
I think that's a problem. And wait, sometimes, and this is a dangerous thing. And I think this is what needs to be looked at. Look, we need to go back and say, was this done because there was political motivation to do that, or was it the right thing? Because if there was no scientific evidence, why is the whole world shut down now? So clearly it has an effect. Clearly probably stricter isolation and things like that for those. I think the 99% of human beings are doing the right thing if they're coming back. They are isolating. The reality is what I was saying before, is there's 1% of the population that the rules exist for, and they won't listen to them anyways. That's a political thing, but I, to some extent, agree.
Hey, Ted, we'll try to get you in here before we wrap it up. How are you, pal?
Okay, doing great. I want to compliment you, Dr. Lou, on your comment there with, people staying at home and not exercising possibly and not eating properly. And I'm looking ahead. I'm thinking of putting this on my Facebook post. Once we get over all this, will the new social distancing, will it be having the government have more of an influence on personal care in terms of will smokers be looked, will they be looked down upon? People that have gained weight, people that people that take drugs, will that be, because that's going to put more weight on our health. We realize that we have burdens on our healthcare system. So
Ted, here's what I will tell you. All of those things, even when you look at smoking as an example, right? This is a disease that affects the lungs. The disease binds to the ACE2 receptors. That was the word that I was looking for earlier, and I forgot it. It binds to those receptors. There's evidence that shows, say, smoking cigarettes actually increases the number of ACE2 receptors in the lungs. So that's probably why this is bad. What I will say around all of this is smoking is good for nothing. Being obese is good for nothing. Eating unhealthy is good for nothing. This is the same thing why being healthy is important, because it prevents all-cause mortality. A virus falls under all-cause mortality. This is not new stuff. We know that being healthier prevents all-cause mortality, and you will do better against challenges, whatever that challenge might be, including the coronavirus. So, do I look down upon it? I think anybody in this world that is still smoking, to some extent, is crazy. The research that we know around smoking and what it does to the body, you need to, and I'm not trying to be dismissive or make this easy, but if you are a smoker, you need to do your best to get rid of that. It's the worst thing you could be doing for yourself.
Well, it's like we've said on the show before, if they came out tomorrow with guys that, hey, man, I just invented this. It's called a cigarette. You inhale it. It would never get approval. It would never get approval.
Never.
Right?
And we're stuck in, and again, my point being is we know that these things are bad for all-cause mortality. It doesn't matter whether it's related to a virus or getting the flu. You're always going to do worse if you have those negative lifestyle and comorbidities that are a result of lifestyle. I think there's one call, but we're running low on time. Can we get them in, John, quickly? Or
no, we got the music behind us, so we're getting the boot. Right. But having said that, it's been one hell of a show. Appreciate all your contributions. We'll do this again next week.
Follow me
and
on
a reminder,
social media, everybody. Let people know social media. That's where you're going to get all this information. Dr. Lou.
And
pinpointhealth.ca, go there as well. Dr. Lou, in several forms, is still open for business. If you need care, if you need answers, 1-855-Dr. Lou or pinpointhealth.ca. Do not hesitate. It is not a closed shop. He will take care of you and figure out a solution. Till next time, Pinpoint Health Show, right here, Global News Radio.
The preceding was a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.